Today we're going to be talking about neuropathy and how the treatment for that neuropathy pain is different in our clinic versus many of the places you've been before. Some of the most common things that people tell us in our offices is, I've tried everything. I've been to so many doctors and neurologists, and everybody just tells me you have neuropathy and you're going to have to live with the pain. And most people do not want to accept that as an answer. Most people don't want to have to continue living with the kinds of pain that you may be experiencing today. So today what we're going to do is we're going to talk about how the treatment in our offices differ from the kinds of treatments you may have been offered in the past. Now, it's important to note that modern medicine hasn't actually changed neuropathy treatment in about 30 years. As you can see from this very old advertisement, they definitely don't use this sort of treatment anymore for toothaches. But even though it's years old, this sort of treatment like Lyrica, Neurontin, Gabapentin, that's still the same treatment for neuropathy. This medication is not even designed for neuropathy, so it's really just as archaic. This is an anti-seizure medication that simply slows down the signals from your feet or hands to the brain so you're not feeling that pain as much, that you're not bothered by the numbness, tingling, burning as much. Unfortunately, this does not stop the progression of your condition. So this condition that's making it so it's harder for you to sleep at night, that's making it so you can't, go fishing, you can't balance when standing on the boat, have a hard time standing up. These things are not improved by this medication. And these medications actually have side effects that can make some of those things even harder, like fatigue, drowsiness, balance problems, memory problems, dizziness, lack of coordination, difficulty speaking, infections, tremors, double vision, fever, unusual eye movements, jerky body movements. These are all side effects that you can actually look up on WebMD that just shows all the different side effects of these medications. And in addition to having all these side effects, it doesn't even always work for every patient. It doesn't even take the edge off the pain for some people. Let me ask you a question. What would you do if you saw this? You turned on your car today and you saw this check engine light come on. What would you do? You'd take it in to get looked at, right? Or if you're more mechanically inclined than I am, you'd probably check it yourself. Now that kind of medication is really just like putting duct tape over that check engine light. It's not really fixing anything, is it? And is that engine going to get better or worse as you keep driving on it? Yeah, it's getting worse, right? And the same thing happens with our nerves. If we just mask the symptoms with the kind of medication that we were talking about, that condition gets worse and worse over time, and all we're trying to do is mask the symptoms and not actually treating the root cause. Now, how is our plan different than the kinds of things like that you've been offered in the past? So there's 3 key steps to feeling better with our plan. We do a test for severity and progression to figure out how far up the leg or hand your neuropathy has progressed. Then we actually give some nutrition back to those nerves, what they need to be able to heal and repair. And we also increase the blood flow to circulate that nutrition so that those nerves can heal better and your feet can start to feel better. So let's review from last time. Remember in our last video we talked about the causes of neuropathy. What's causing your numb feet, burning, tingling, all those things? Well, it comes from damage in the nerves. This outer portion here that keeps that nerve healthy, see how it starts to get damaged? If it starts to get damaged, it starts to lose blood flow, starts to have these sorts of problems, this is when you start to get numbness, tingling, burning. Your nerves are sensing that there's damage. They're sensing something's wrong. And if it doesn't get taken care of, it can start to look even more like this. What do you notice is missing down here? It's missing those blood vessels, right? And so the circulation is one of the most important things for those nerves to constantly have in order to keep them healthy, keep them functioning properly. So we do a 16-point neurologic exam, and then we actually do a biopsy to determine the progression of the neuropathy. So we'll find, has it reached up to the calf? Has it reached all the way up to the knee? How far has it progressed? Or is it just in the feet? And we may do x-rays if needed. For example, if there's neck or low back damage, there may actually be some x-rays that your provider will request on that day. And then we do a vitamin blend injection. The vitamin blend injection has all kinds of things to help your nerves. The vitamin blend helps to maintain the health of the nerves, helps nerves regulate their energy properly. Have you ever felt like your feet just get tired at the end of the day? You feel like your feet are much worse at the end of the day than they are in the beginning? That's probably because they're not regulating their own energy well. And so that's an important thing that vitamin blend actually helps with. May strengthen the immune system as well. Some of the nutrients help with the immune system. Protects against aging damage. That's what antioxidants help with. Maintain normal nerve function. Anti-inflammation. Now, inflammation is one of the things that causes a lot of that burning pain. Nutrients for cell growth and healing. And protects and promotes regeneration of nerves, as well as nutrients for healthy blood vessels. Remember what we just talked about, how important blood vessels are for healthy nerves. Facilitates wound healing. Now, do you ever feel like your wound healing, especially in your feet, is not what it used to be? These nutrients actually help facilitate wound healing. Promotes proper red blood cell and white blood cell production. Nutrients for healthy bones and joints. And also, the vitamin blend contains a local anesthetic, so you get fast pain relief as well. Now, I'm talking a lot about feet because probably 90 to 95% of our patients are feet neuropathy pain patients. But remember, all this actually applies for hands as well. If you have neuropathy in your hands or you have carpal tunnel, this is something that helps patients just like you as well. Now, after we give the vitamin blend injection, we actually use an electrical stimulation to reduce pain and improve blood flow. So this actually helps to stimulate the circulation, which actually gets those nutrients pushed through in the tissues, circulating in those areas so that all the cells get that nutrient that they need so that they can start healing better and feeling better. Now, I want you to ask yourself these questions. How would life be if I were able to resolve my health issues? What would be different? What would you be getting back to? Playing with the grandkids, fishing, golfing. What would you be doing? How has my life been affected by this health crisis? My relationships, my ability to work, my ability to enjoy life. What's stopping me from scheduling an evaluation today? So I'm going to tell you the 3 easy steps to start this journey that we're talking about today. Call now to schedule your appointment, and the number is here on the screen. Come and attend your consultation and examination. And if we find we're able to help you and accept you as a patient, then you begin your journey to getting your life back. That's the ARC proven process. We want you to start this journey and start healing better and feeling better so that you can start really enjoying those golden years the way that you want to. We hope to hear from you soon, and I hope you guys have a great rest of your day.